So, no needle mesotherapy for skin rejuvenation, innovative and very easy procedure, very interesting as a so the type of treatment and product will achieve the subtle change the patient is looking for. This is my opinion. I think you are with me. So this is MPS, the microporation system, for very quick and effective and safe skin rejuvenation. The features are as shown over here. If you're interested, the company has everything about this product. So what does microporation mean? With the creation of electrical pores, which is known, I think this process is known since around about 15 years. There were two Italian colleagues who detected this phenomenon. We have to apply short, that means 20 to 80 microseconds, but very high voltage impulses. For example, we are starting in the face at approximately 40 and in the body at approximately 60 volts. And these pulses are directly applied to the skin. And the pulses open so-called pores. This has nothing to do with the normal pores of the skin. It's just, let me say, better say, it's aqueous channels. Channels like, as we know, in the heart, monitored by calcium and magnesium. So, with this machine, we open the pores and subsequently, somewhat longer, we apply longer voltage impulses to the skin to keep these pores open. Because this was a problem till, let me say, 4 or 5 years ago. The opening of these additional pores is not so difficult, but to keep them open over a certain time, this is the difficulty. And now, with this so-called keep the pores open impulses, we can keep them really open over minutes, and this is very important. So the Adoderm microporation system allows the transdermal delivery of topical fluids into the skin layers by the process of the electroporation. How does it work? Everybody knows that the stratum corneum is a very dense barrier of the skin, and normally this structure is very stable and has a high degree of electrical resistance. This making an excellent wall to water-soluble molecules. So if pulses, as I have shown, about 60 volts is applied to the stratum corneum, there's a rapid reduction in the electrical resistance of the skin, allowing more electrical power to pass through. And this causes an opening of these channels in the stratum corneum, allowing the introduction of the substances transdermally into the deep layers of the skin. So how does it work? To create these electrical pores, we have these short high voltage impulses, 40 for the face, 60 volts for the body. To open the pores, and then to keep the pores open over a period of time. This is a device. Microporation is an impulse generator, very easy to use, with a touch screen display, set of electrodes, pinball head for small areas and for lines and wrinkles, and we have a roller for larger areas. Setup mode. We will show it for every interested colleague. We have a machine over here and we will show it. Use of the electrode. Metal electrode is a cathode and the soft electrode is an anode and is placed on the opposite of the treated area, arm or back, for example. There is a very nice collection of treatment. Hyaluronic acid-based formulations rich of active ingredients for several indications. We have the so-called Adophase. You see the indication behind, Adovital, Adotox, Adoacnex, very good for acne skin treatment, Adowhite for skin pigmentation. I think this is very interesting for your area with several pigmentation problems, and Adocellulite for cellulite reduction, and new Adocure Medical reduction of skin inflammation. So you can combine, for example, Adocure with Adotox. So you have a very nice wrinkle reduction and reduction of skin inflammation in one hand. So I will not go into each of the ingredients. They are pointed out in the material the company can hand over to you. So just to pick some highlights. For me in my clinic, I'm working with all of these products, but in our area, acne is a very big problem. With the wrinkles, beside the wrinkles, acne is a big problem in our area. So I'm working with the Adoacnex, which is based on oleanic acid, and you can see very high quality ingredients of these compounds. Adowhite, for example, it's containing acetyl-baldine for reduction of the tyrosine kinase activity and vitamin C. This is the cellulite and the Adocure Medical for all skin appearances showing inflammation. It's good in combination with laser procedures, very good in combination. So the skin care treatments with the microporation system can be ideally done with HA-based products. Treatment protocol, step 1 is a basic cleaning of the skin surface. If necessary, and it's very good to do acid peeling to remove the surface of our skin, which means the corneocytes. Neutralization after this, for sure. Then the MPS system, the therapy, and after this there are very nice and smooth care devices for the surface of the skin. So this is a complete system overview. So we have Adopeel peeling systems, peeling acids, glycolic peelings as shown here. It's a so-called ivory skin peeling, which is very nice combination of glycolic, lactic and mandelic acid. And a purifying peeling, this is very nice, especially in combination with the acne procedures. So it's very important to always neutralize. As we know, peeling has to be, chemical peelings have to be neutralized. So the skincare treatment with the microporation system are cosmeceutical, mesotherapy, NDA, dermabrasion, filler PTX and laser. Excellent assisting and combining therapy. So just to show one case, this is a cleaning and the fluid acid before. This is MPS system. This is a small head for wrinkles and smaller areas, especially periorbital wrinkles and glabellar folds as well. And this is the roller. And now the result, even immediately after the procedure. This is why we are calling this so-called Hollywood lift. You know, every Hollywood star before the great event is doing something. They do not tell us what exactly. Most of them tell us they look fine because they are drinking water and they have a good personal trainer. But I do not believe that. Some astonishing facts concerning our skin. 1 square centimeter means 600,000 cells, 5,000 nerve cells, 4 running meters nerve tracts, 100 respiratory glands, 1 running meter blood vessels, 15 sebaceous glands, 5 to 10 hairs, and 150,000 melanocytes. So this is why I'm saying take care for your skin, because it's very precious. Another case, a 75-year-old lady with a combination of glycolic peeling and MPS system, and the result after they left our cosmetic department. So this is what we say, call it magic or Hollywood lift. So once again, thank you for your attention, shukran, and thanks.
Thank you, Dr. Demish, for this those two interesting talks. Before we move to our next speaker, I think the subject will change significantly.
So I say the varioderm, I'm talking now about
variofill, it's
variofill is 24 months. I have some cases exceeding 24 months. I have some cases came in a bit earlier, but normally in the average we can say 24 months. But it depends, and you're right, and I think with me it depends on the anatomic region, as we know. Regions with many movement, with muscular action, maybe they are causing earlier disappearance, and in other areas it stays longer. But 24 months is a very good average in my experience. This is my personal experience.
Okay, and when you inject, when you put after 2 or 3 months, you feel the consistency. It's not hard.
Yeah.
It's hard.
No, it's not hard. It's like a liquid. We call it liquid implant. So especially in the breast, so I did many cases with the breast, because I told you some women in our country
especially
do not want to have a big increase of the volume, and I did many breast procedures, and it's around about 24 hours, and it's very smooth. The ladies like the feeling. It's very, very smooth. The first days there's a bit swelling, there's a bit feeling of a strange body, of course, because there is volume in, but let me say after 1 week it's very natural, it's very soft, it's very, very, very cozy, let me say. It's very good, very nice. Yeah.
Yes, thank you really. Do you combine this material with fat at the same session or after?
With fat?
Yeah.
You can. Excellent idea. I had the idea because I had some cases with hypertrophic scars and breast augmentation with autologous fat. And I combine it because of the very good lifting force of the variofill. It's excellent. And it goes very well with the autologous fat. So you can combine it, definitely. Because fat makes a good volumizing effect, but no lifting. And with the variofill, we have a very good lifting force.
In the same session?
In the same session. You can combine it in the same session. First I do the fat, and after this I place the variofills. In these regions I like to have the lifting effect. So it's very good. It goes very, very fine together.
You have to put a lot of material inside, a lot for we know.
Depends on the wish. So I try to show the.
Sorry, I give you an example for butt augmentation. We put 350 ml in fat minimum here. Yes. So how much I have to put?
So the largest amount I put in, especially in the breast, in one session. You can do an additional session. I tell the ladies, please come back some month later. We can do a second session. There's no problem. It's a local anesthesia. The biggest amount was 200 ml each side. 200 ml. Because, as you know, this is nothing new. you know the skin has to follow the volumizing effect. And if you put in too much, especially this is my experience, autologous fat, the body is going to reduce it immediately because the skin is not in the shape to take this in a place, and the body is reacting immediately. This is my opinion.
I agree.
Yeah? Okay.
Thank you.
You have shown us very nice results actually, but I realize that you do not inject the filter, is that right?
I do inject.
You do inject?
Yeah.
Okay.
But it's a, let me say, it's a policy of the company not to say injection in the tear trough is a beginner's treatment. So you have to know well-trained and good experienced colleagues as you are can, of course, inject in this area. If you are familiar with the anatomy over here, you can. And you do facial procedures such as blepharoplasties or so on, like me, you can, you know what happens. So you can inject, definitely.
If you are confronted with a case injected with some other film, are you there to inject this one, and how long?
Okay, when let me say, I'm glad when the patients know what they have in. Many patients do not know. For me, it's always astonishing. They take the car to the best company to get it done, and for themselves they do not care about what it's injected. So when I know it's a hyaluronic acid, a modern hyaluronic acid, there's no problem. But once again, this product is 4 times more cross-linked. It's a powerful device. So what I'm doing when someone is coming in and I can feel there is some material left, I give him a new date. So I say, please come back after 4, 6, 8 weeks when it disappeared. So we are on the safe side. Yeah. And when I do not know what it's in, especially when I'm wondering maybe there's some permanent, I do not treat with no material. So it will cause problems. And you know, the last doctor is the devil, not the pre-injecting. Okay.
Dr. Shachi.
Again, you mentioned that fast that if a patient has permanent filler, you don't inject.
In the same area.
Yeah, but you mean another area you can inject.
Yes.
Okay, if a patient comes with a problem or complication or asymmetry, or you want to remove it, you have a special criteria of how to remove it?
For the permanent?
Yeah. Whether in the buttocks or in the face?
Yeah, no special criteria. The normal, in most of these cases, you have to do incision and try to get the material out.
Some of it hard.
In many cases, it's not possible.
Yeah.
Yeah. So we have to run a surgical procedure, in my opinion. So it's not, for the patient, is no, in many cases, this is no aesthetic, good aesthetic result when we have to remove that. You know this. So
if you remove and you remove small part of it, after certain time, 6 months, 1 year, can you re-inject fat over the material, even if there is just little or no?
When you are sure you are in a different layer, it depends on the layer. If you are sure you are in a different layer, you can do. So, for example, if you are sure the permanent is in the subdermal region, you can inject in the dermis. It's okay, because different layers, but not in the same layer. Please do not inject in the same layer. I have seen so many problems.
Regarding cost price,
Yeah.
like public documentation, it's material or breast, we want to have an idea about the cost price. The second question, this high rate of cross-linking, is it FDA approved?
So, I think we have the Dr. Dogan over here, and he can tell for this technical, for the second part of your question. He is closer to this than me. I'm the medical part. But your question, the first question was the cost relation.
Okay,
Okay.
but it's the FDA.
it's in my clinic, so I only can tell you what I'm charging my patients. So for a breast augmentation, it depends on the volume. Let's take this special case I showed, and I charged 4,000 €. So it's not so far away from implant. This is what I say. It depends on the wish of the patient. When they say implant is good, they will get the implant. If they say everything but no OR, no implant, we have the alternative. Okay, but from the costs, there is not so a big difference.
In comparison to macro lens, for example.
Yeah, this is not, you cannot mix, let me say, you cannot mix apples and bananas. Macro lens is like, in comparison to variofill, this is, once again, this is my opinion, it's like water. You have 20 milligram per milliliter. I know they have a 30 milliliter device, but
20.
They have
but you cannot compare it. So in one hand, variofill is 33 milligrams per milliliter, the other one is 20. So there's a difference of 70%. So you cannot compare. I know Macrolane is a bit cheaper. I know they are now forbidden for breast augmentation purposes. So.
Should we tell the patient we need for buttock augmentation 10,000 €? This is the cost. This is a problem.
Yeah, I do not know your price findings. So, but once again, it's not so far from the implants. You're right, because good materials have their price.
I just want to remind everybody that this is a scientific meeting. We'd like to have the questions not towards the marketing or towards the price, but towards the scientific data. For that, I would have two questions about the scientific aspect. Injecting the breast. I personally, against some of my colleagues, I'm against even fat injecting the breast full. As a conservative plastic surgeon, I think it can cloud the picture of future detection, over-detection or under-detection. As a filler injected in the breast, I have two questions. Have you had any studies, long-term studies about that factor in terms of clouding the picture of future diagnosis of a patient destined to have breast cancer? And the other question, if you had an infection, and this is, for instance, sort of augmentation with lipofilling, there have been incidents of infection, at least it's very small. If it's infected, it can be drained, and it's not going to be a major, it is a disfigurement, but not as much as in the breast. So if you have a filler infection, it's not like an implant that you can treat with antibiotics. If it's failed, you just remove it, wait it out with another one. How do you handle infected liquid filler?
This is a very good question. I'm absolutely with you because of the problems with the detection of breast cancer and so on. So I sent my patients prior to this. I sent them to X-ray, and but I know about these problems. So and your second question was how to handle infection. Lucky me, let me say it this way, I hadn't any infection because of you saw it in the pictures, I used to handle this extremely sterile because this is no lunchtime procedure, it should be done in the OR, and once again, fortunately, I haven't had any infection. In case of, you have to treat it, and I'm with you, it's a bit difficult to have a liquid filler come out. You have to drainage it over days. I know one case, not with the variofill, I know one case from a colleague with intensive care treatment for the lady treated. So I know about these problems. And so my approach is to work very extremely sterile, not to cause any problem. This is my answer.
Okay, I think.
Last question, because we have to.
Yeah. When you said about the hindering the detection of any cancer, you are injecting superficial subgland is away. The gland is pushing up. It will not interfere with.
Yeah, I try to enter in all my cases. I have luck. what was on my side. So yeah, it's very important. And executive decision on we have to push up the lifting effect and no penetration of gland structures also. I just think Dr. Dogan should say in completing your answer something about the FDA clearance or.
We are a European company operating in Europe mostly and then having Asian countries. And we don't have a representative in FDA, in the United States. But our project is within 2-3 years to apply FDA approval for our products. And we are in 55 countries worldwide represented. And we have a Canada registration right now. So close to the FDA approval. Thank you.
Okay, thank you.
Thank you very much.
My pleasure.